Hospital admissions in the Western Cape are increasing, not only due to the resurgence of COVID-19 cases, but also because of the spike in alcohol-related trauma cases. There are now more than 15,000 active COVID cases in the province, and the number of deaths is steadily rising. Now, Premier Alan Winde has said he does not support more alcohol restrictions. But with the burden on hospitals growing, health officials say there's an impact on regular cases and elective surgeries. Ayesha Ismail reports.
More than 1,000 new cases daily in the past week. Hospital admissions up by almost 300 a day and deaths over 20 a day. And these figures are all rising.
These hospitalizations have now begun to increase sharply, while we are also experiencing the trauma burden, and alcohol-related trauma puts a big burden on the healthcare system and hospitals. Also surgical pressures, and then psychiatric pressures, and also maternity and neonatal pressures.
Clutie says while they are still analysing numbers, all indications are that hospitals have started experiencing increased alcohol-related caseloads.
The alcohol-related trauma cases, since the lifting of going to level 1, lifting of the restriction of the hours and the days, has increased at the trauma units that we've been tracking, the 5 trauma sentinel units.
Clutie says verified figures will be released later this week. And while the Western Cape is able to cope with COVID-19 cases for now, health authorities say this comes at the expense of other health services, which may end up being scaled down again, like during the first wave, if people continue to behave irresponsibly. A major concern is also for the well-being of healthcare workers, among whom the COVID-19 cases are also increasing. Ayesha Ismail, Cape Town.